In Maharashtra, as part of the Maharashtra Nursing Home Registration Act, modified rules of 2021, there are a set of patients' rights which are actually legally mandatory for every private hospital to implement. See, first of all, we need to understand that there are considerable figures which show that the largest number of COVID deaths in the world took place in India. There are two things. First of all, in rural areas, utilization of public health system is higher. So obviously public health services need to be improved, they need to be expanded, and they need to be made more effective. And secondly, even for people in both rural and urban areas, they are supposed to get free care in charitable hospitals.
Hello everyone, I'm Chaitraly Deshmukh. Pune Times Mirror in our Mirrored on Mirror podcast is paving our routes on various awareness and literacy segments for rekindling the rights of citizens. Based on the social, legal, economic, political, other stratas of issues. Citizen voice, we roar. The Indian healthcare system is faced with several challenges, including increase of health cost, the need of nursing, the long-term care of vulnerable sections in the society, as well as the financial burden on the household, working culture, negligence of public health functioning due to inadequate facilities. But many forget that right to health is a fundamental right. It's indeed a great pleasure to welcome Dr. Abhay Shukla, a public health specialist and a senior scientist as well as working on a key person associate with Sati, Pune. He is leading the healthcare baton with People's Health Movement India, a gold medalist from AIIMS. Dr. Abhay Shukla is a public health expert. He has been religiously working on public and community health care for last 35 years. He's authored 3 of his prominent books which talks about review of healthcare in India, the health system in India, crisis and alternative, and deciding diagnosis, which expose the malpractice in private medical sector in India. Dr. Shukla has been involved in developing the concept of community-based monitoring and planning of health services. Sir, I welcome you on this platform.
Thank you.
Sir, rights of patients is one of the fundamental rights and many people are unaware about it. Especially this right comes to the people approaching to the private hospital. So is there a legal provision related to it?
Yeah, actually patients' rights are very important because patients are among the most vulnerable section in society. And when a patient approaches a private hospital, they are in a very vulnerable situation, the patient and their family. And therefore, as part of the National Human Rights Commission, the Government of India and the Government of Maharashtra have all come out with very clear patients' rights charters. In Maharashtra, as part of the Maharashtra Nursing Home Registration Act, modified rules of 2021, there are a set of patients' rights which are actually legally mandatory for every private hospital to implement.
Every private hospital?
Yes. Every private hospital in Maharashtra, their registration is actually linked to the observance of these patients' rights.
Okay.
And so there's an entire charter. Many of the rights are given in section 11Q of the Maharashtra Nursing Home Registration rules. So some of these rights are the right to information.
Okay.
Every patient has a right to know what is the treatment, or what is the diagnosis, what is the expected treatment, how much expense is going to be there. Every private hospital is supposed to display 15 indicative rates about bed charges, about operation charges, about consultant fees, etc., so that you can know whether this hospital is you can afford it or not, and you'll also have an idea about what is the expected bill. And the hospital we also have a right to know the expected total expenditure of treatment in advance. Every patient should receive an itemized bill, which gives the full details at the end. Every patient has a right to their records and reports, blood tests, CT scan, MRI, and even the case papers during the indoor admission. Many people do not know about these rights. There's a right to confidentiality, a right to non-discrimination, and a right to receive care with dignity. You have the right to choose where you want to buy the medicines from. It cannot be dictated by the hospital. And similarly, the patient has a right to choose where they want to get their tests from. So these are all very important rights, and other rights also. The Union Health Ministry has come out with actually a 20-point patients' rights charter in 2021. But unfortunately, this is not well known. It's not well publicized.
So it's a new thing altogether. Like when we approach the private hospital, we just step down. It's more like, when we approach the court, we don't want to approach the courtroom because of more of the hassle time and everything. It's similar to the same situation. So now you mentioned about the rights of patient. But who is bound to publicize about it? Is it government? Is it the private hospital? Or we as a social worker need to march ahead?
So actually the primary responsibility is of the government to publicize these rights, and for every private hospital to display the patient's rights charter.
Oh.
Unfortunately, neither of these is happening adequately.
So all private hospitals,
yes,
you mean? Oh.
Every private hospital in Maharashtra, private or public, is supposed to display the patient's rights charter.
Okay.
Yeah. And of course, the government should publicize it through various channels, through the audiovisual media, through the mass media, etc. Since this has not been happening adequately, as Sathi, we came out with a series of social media posters on these patients' rights. This is available in Marathi, in Hindi, in English, and basically these actually explain through cartoons and through very simple visuals what are all these 20 patients' rights. And similarly, we have come out with what we call a pocket charter, which people can basically keep in their pocket. And when you go to the hospital, you can open this and both see it and also show it to the hospital management that these are the legal rights which I have as a patient.
Okay.
So it's people should know about these rights very widely, because when people climb the stairs of a private hospital, they tend to forget that they have rights. They only think that they are like customers or consumers, but it is not so. We are also citizens, and as citizens, we have rights even in a private hospital.
So good to know about it. So even if you are approaching the private hospital, so don't bear the burden that you are under a client. Consider you yourself has a right to health. So moving on to the next question, sir. So rules are laid down. We all are aware there are good rules that have been governing for the rights of citizens, which are there in the various laws and everything. But sir, when it comes to implement, we are lacking. Do you think?
Yeah, actually, many of these regulations are not being properly implemented. And 2 years back, as Jan Arogya Abhiyan and as patients' rights groups, actually a survey was conducted in 100 private hospitals across some cities of Maharashtra, in Pune, in Sangli, in Nashik. And it was found that 95% of the private hospitals were not displaying the full patient's rights charter. Almost none of them were displaying the rates which they are supposed to display. Then these issues were raised with the municipal corporation, with the officials. After that, they issued some orders. So some amount of display has increased, but still it is not being displayed in most hospitals yet. So this is something which should be actively followed up. And every hospital should display the patient's rights charter and their rates of services.
Alarming incident related to the healthcare sector was alarmed and found during the COVID crisis, the pandemic crisis. How do you see the situation and how Maharashtra tackle it?
See, first of all, we need to understand that there are considerable figures which show that the largest number of COVID deaths in the world took place in India, including the recent SRS figures. They very clearly show that we had a huge number of COVID deaths, at least around 20 lakh COVID deaths. Out of these, the largest number of deaths in India was in Maharashtra state. And out of Maharashtra state, the largest number of deaths were in Pune district, where we are sitting right now. So actually, COVID was a huge wake-up call. It should have been a huge wake-up call. Anyway, what happened in private hospitals during COVID? So one aspect of that is the overcharging by private hospitals. There was denial of care in the first wave, when many hospitals, they shut down, or they did not admit COVID patients. The second wave particularly, there was huge scale of overcharging. So we did a survey on this. And we did two kinds of surveys. One of the citizen survey of 2,500 patients, COVID patients. How much had they actually paid per day? And it was seen that more than 80% had actually been overcharged. And then we did another scientific survey actually analyzing the COVID hospital bills of COVID patients, line by line. And we found that 84% of them had been overcharged. And the scale of overcharging was 4 to 5 times. More. It was not minor, it's not 10% or 20%, it was 4 to 5 times higher compared to what the government had laid down. So as a result of this, what was done is that Jan Arogya Abhiyan and another network called Corona Ekal Mahila Punarvasan Samiti, which is a network of COVID widows, single women whose husbands had died during COVID, we came together and carried out a campaign
Okay.
and asked the government to do an audit of the hospital bills, COVID hospital bills.
Oh.
Whoever came up with a complaint, their bill was audited. And this was done in almost 30 districts across Maharashtra, nearly 500 hospital bills. It's very complex to audit a hospital bill. There are hundreds of items. So anyway, those bills were audited and we actively participated, and 63 patients got refunds from private hospitals as a result.
Huge number.
Yeah. And up to 50,000, 1 lakh, 1.4 lakh, significant amounts. This was an unprecedented kind of situation. And we responded to that. But it shows that if people are active and the government responds, then private hospitals can be made accountable.
Okay. So moving on to the next question. Efforts to national level regulations have been made after COVID crisis. Do you see there is a lot of efforts that has been taken?
Actually, there are regulations since before COVID. There's a Clinical Establishment Act, which was passed in 2010. And this act is a very important act. It has been adopted by 12 states. Maharashtra is not among them, but many of the northern states are there. So like UP, Bihar, Rajasthan, Jharkhand, Himachal, all of these states have adopted this act. And in this act, there are several important provisions like the regulation of rates, transparency of rates, implementation of standard treatment protocols in private hospitals, etc. But for this act to be implemented, one important component was that minimum standards need to be declared. Because when you do a registration, you have to check whether the hospital is fulfilling the minimum standards or not. Those standards were supposed to be declared at the latest by 2014. Now we are in 2025. And these minimum standards have still not been declared.
And what was applicable in 2010 cannot be applicable now, considering the lifestyle and the socioeconomic strata.
But even considering that we go by that act as it is, those standards need to be actually notified. So Jan Swasthya Abhiyan, the national platform which I am part of, has filed a PIL in the Supreme Court. And the main demand in that PIL is that private hospitals should be effectively regulated. The existing laws for regulation should be implemented. Rate regulation should be actually implemented. Transparency of rates should be ensured. And patients' rights charter should be properly implemented. And there should be a grievance redressal system for patients. These are all part of our PIL. And it's being heard by the Supreme Court.
So I've also heard that you have conducted related to a poll related to public health awareness. Can you elaborate on that aspect also?
Yeah, actually this opinion poll which we launched last month on 7th of April, which is World Health Day, is about people's experiences in private hospitals. So there's 5 simple questions. There's a small link. It'll be good if you can publicize that link. And as part of that poll, we basically asked 5 questions. Have you been overcharged in a private hospital in the last 5 years? What was your experience regarding excessive medications or excessive investigations or unnecessary surgery being advised? Were you made aware of the rates before the admission or at the time of admission? Were the rates displayed or not? And also similarly, whether you support the regulation of rates in private hospitals and whether you support the implementation of the patient's rights charter. So we have gathered more than nearly 1200 responses on this, and we are analyzing the data right now. But the vast majority of people have actually experienced overcharging, unnecessary medication or investigations, and nearly 98% people are in favor of implementation of patients' rights and regulation of rates.
So at present we are looking at city and private hospitalization because the infrastructure, the facilities that are there within the city and the metropolitan cities. But when it comes to rural, how rurals can be when it comes to fringe areas and the rural area, how it can be aided to them also?
See, there are 2 things. First of all, in rural areas, utilization of public health system is higher. So obviously public health services need to be improved, they need to be expanded, and they need to be made more effective. And secondly, even for people in both rural and urban areas, they are supposed to get free care in charitable hospitals. In Maharashtra has nearly 50,000 such beds where people, where people should be getting free care, poor people, and or highly subsidized care. But that provision is also not properly implemented. 20% of beds have been reserved, but they're supposed to allocate only 2% of their revenue.
Revenue, right.
20% bed hai aur 2% revenue, iska kuch logic
nahi.
And even jo available bhi hai, that is not being properly implemented. So that's another major area where action needs to be taken. And of course, for rural areas also, there are schemes, and there is this entire Mahatma Phule Jan Arogya Yojana, which is supposed to support people for getting hospitalization care at least. So these all need a lot of streamlining and improvement, because right now people are not being able to get the free care that they actually deserve to get.
When a patient's approach to the hospital, he's mostly worried and his priority is something different. We are talking about awareness, but at that particular point, the person's mentality is altogether different, because he has to tackle with entire different segment altogether. So how a person can reach out if they face this issue?
So as Sathi, we have launched a helpline. This is the helpline number which patients can approach in case they have a problem in a private hospital.
Okay.
So many patients complain that they have been grossly overcharged. They were not made aware of the hospital bill estimate in the beginning. In the end, they are presented with a huge hospital bill amount.
Oh.
Many of them are not given itemized bills. And then there are other issues of insurance schemes not being honored, not being actually, getting care under the insurance scheme, which should be free of charge, but still they're having to pay significant amounts, and other kinds of violations like detention of the dead body of a patient in a hospital just to extort a higher
extort
bill.
money.
So such patients keep contacting this on this helpline. I'd encourage you to inform the viewers of this show also about the helpline. They can contact us. This is a small effort, and we are able to guide at least some patients and support them. But actually the larger measure which needs to be taken is part of the MNHRA rules. Every city and every district of Maharashtra should have a grievance redressal cell for patients run by the government. This is part of the MNHRA rules. And it should have a toll-free number.
Oh.
Yeah. So that is something that we have demanded, we have asked for, and it's there in the law. I mean, it's there in the rules. But unfortunately, it has not been implemented almost anywhere. With quite a bit of effort, at least the numbers were started in a few cities, but they have to still be made fully functional. So all these provisions are there. As citizens, we should demand these, we should ask for these, and we should actively, get involved in implementation of, patients' rights.
With this, we wrap up today enlightening conversation. We are reminded that the health sector is not a privilege, it is a fundamental right. Dr. Shukla, deep insight and dedicate of unwavering committed to public health have shielded the light on the urgent need for the system reform. We thank Dr. Shukla for joining us. His vision and continues to inspire a movement that holds institutions accountable and place people at center for public health and policy. To our listeners, let this be a call to awareness and action. Understand your rights, demand accountability, advocate for health system that is accessible, affordable and equitable to all. Stay tuned for more episodes of Mirrored on Mirror. We are continued to reflect on the issue that matters, amplifying the voice that counts and spark the change we deserve. This is Chaitraly Deshmukh signing off. Until next time, stay tuned and empowered. Thank you.